Good morning and welcome to our COVID-19 pandemic update. My name is Stephen Williams, Director of the Houston Health Department. With me are our top public health docs from the city of Houston and Harris County, Dr. David Persse and Dr. Umair Shah. This is our sixth week providing COVID-19 updates in partnership with the Rotary Club of Houston. I want to thank Kathy Finninger, President of Rotary Club of Houston. Over 25,000 have viewed these presentations, and we thank you for all the valuable information and partnership between the city and county. A lot has happened over the last week regarding opening back up, regarding masks. And the first question we have is, can we project that the city of Houston and Harris County will continue to issue the same procedures and policies, such as wearing masks, when outside the home? And who is really the last authority on that issue?
Well, the last authority is the governor. The governor can, can overrule, or the governor's order takes precedent over the county judge, which takes precedent over the mayor.
Yeah, and I think Dr. Persse and I, first of all, let me start by saying, Stephen, thank you for the last several weeks having us here. I think it's just been, I know when we started this, it was hey, let's see how this works, and gosh, it's been great to be able to come on a weekly basis and see the evolution of this pandemic and be able to very frankly talk about it. David is absolutely right, and I think Dr. Persse and I are, what our role is to give the information, the public health information, the science information, and we know that's changing on a daily basis. We make the recommendations, we give and provide that information, and from that standpoint then policies are created based on really what we're trying to do, which is at the end of the day protect our community. We know that masks being worn are not a substitute for social distancing, but they're complementary to. So when you add the 6 feet social distancing and you're wearing one, I'm wearing one, we're protecting each other, and we have the 6 feet, you've got an ideal, in addition to hand hygiene and all the other things we talked about, you've got an ideal way to actually protect each other, especially in settings where all of a sudden, right now we're 6 feet apart, but let's say we have to look at a document together and now we're 1 foot apart, and now all of a sudden that mask actually helps protect us.
Okay, thank you. It's been suggested that Los Angeles actually began having cases earlier and in far greater numbers than initially reported. What are your thoughts, concise thoughts about this?
I mean, the one thing I would say is that, there was not just that in San Francisco area and the Bay Area, they were talking about the real deaths that were occurring. They were saying that in late February there were deaths that had occurred in mid to late February. So I think, there's a lot that we're going to go back and learn about this. But I do think that as we are starting to get more information, we're going to start to put a timeline together that may be markedly more robust than when we discovered things in Seattle as the first case, that it may have been happening in other parts of the country as well, especially on the West Coast.
Yeah, it's not too big of a surprise to find out that was going on, because people weren't knowing what to look for, and the tests weren't available to make the diagnosis. So, I heard last night it was a good thing that the 49ers didn't win the Super Bowl. Because had they been, the big celebratory, ticker tape parade may have been fundamental in spreading the virus further than it spread already.
Yeah, what are your thoughts about resuming non-COVID related procedures, operations in the hospital? And what are the risks to the patient and also the folks performing the surgeries?
Yeah, that's a really interesting question. The hospital community has really done a great job, and I think we really need to applaud them for doing creating a bunch of capacity in the hospital to take care of COVID patients. Now, fortunately, so far, because of the social distancing, not having a lot of mass gatherings, wearing masks, hand washing, all of those things, while the hospitals have reduced their the occupancy to make room for the surge, we haven't seen it. Now, that's not because they did anything wrong. That was the right thing to do. At the same time, there are people out there who need procedures to be done, and so there is the capacity to do that. But yeah, it's a hospital setting, and so the healthcare workers are really on the front line getting exposed, and we've got to protect them. And so today it's better because they're doing much better, I think, with their own PPE and their own procedures, and they're up to speed. So I think the risk is a whole lot less than it was a month ago. But it's going to be interesting to see what happens. People need those procedures, and the hospitals need them to happen.
And my additional only concern is about the supply chain on PPE, that right now we've been better in our community because we have not had a lot of those elective procedures in terms of hospitals being able to procure all that. So I'm just hopeful that as you bring back online those elective procedures, that the hospitals still have the ability to provide those PPE, the personal protective equipment, masks, gloves, et cetera, for their employees.
What is the level of risk for patients?
Well, anytime you go out and you are in environments where there's a lot of people around, the risk goes up. It's going to depend a lot on how hospitals manage this. I can't imagine hospitals going back to functioning the way they were a couple months ago. I mean, none of us are going to. So even with the hospitals, they're going to be worried about protecting not only the patients, but also their staff. So as they start doing more elective procedures, there will clearly need to be a different standard of practice.
Yep.
I'm going to change the next question a little bit because y'all have talked about it. It was related to the residents, staff, and patients. But do the current tests that we're doing in the community really identify the extent of the virus in our community?
I don't think so.
No. No. We've talked about this a lot, and we've been saying, just yesterday at the press conference, we were saying that what the testing in the community does, it gives you a breadth of how much transmission potentially is happening in the community. And what the hospitalization data gives you is the depth or the severity of those people because they're going to the hospital because they're sick, right? So breadth and depth or severity, those are the two factors. The truth is that we've got a lot of testing out there. It's better than it was, not where it needs to be. Those testing constraints still are in place, but also not all of the testing is based on where or what or how or who should be tested. It's really random, right? You want to go get tested, you've got some symptoms, you go. We don't have really all that worked out because we just don't have enough testing throughout the community. So I think right now we're still working through all that, and I think that it gives you the best number, and you have to then make some decisions like if you have one positive, how many does that represent? But again, it's really some modeling that we're doing on that.
Yeah, and you got to understand how we got to where we are today with testing is because of what became available and when it became available. If I were to want to create a way to monitor the community for how much virus is in the community and how it's spreading and with the rate of its spread, this is not how I would do it. So we're working with what we have, but it's not really answering the question that we want answered.
That's right.
Okay, we're going to explore that a little bit more in depth in terms of what we really believe need to happen. But right now we're going to take a break and be right back with you. Thank you.
Wash your hands. Scrub them while you sing the song. Wash. Rub your hands and fingers in the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1.
Taking care of yourself is also taking care of others. We're all in this together.
How does the 2020 census affect representation? There are 435 seats in the House of Representatives. These get distributed to the 50 states by population, and an accurate census response helps your state get the right amount of seats. States with smaller populations get at least one, while states with larger populations might get more. Shape your future. Start here. Visit 2020census.gov.
Hi, I'm Stephen Williams, Director of the Houston Health Department, and welcome to our COVID-19 update sponsored by the Rotary Club of Houston. We left you talking about, how to identify the extent of the virus within the community. We know that from a public health perspective, a lot of the information we've been reporting out is not necessarily the way that we would ideally want to report it. We've pretty much been responding to a demand from the public and quite frankly, our bosses in wanting to get this information. What do we really need to do in order to get a good idea of the extent of the virus within the community?
I think we need to engage in a well-designed study, a public health-based study of the prevalence as well as the incidence of the disease within our community. And so this would mean it would be in every neighborhood, there would be some ability to test, and we'd be collecting a lot of information about the people who got tested, above and beyond just age, gender, race, but also occupation, something about the neighborhood, census tract information. What is this person's occupation? What are a little bit about their daily habits and how much they interact with others? And get a lot of information about those folks, but it would really need to be basically in every neighborhood, and ideally we would do it more than once. So get a snapshot, and then 2-3 weeks, a month later, take another snapshot and see how things are at one point, much more granular we're getting now, and then how it has changed even just a month later.
Yeah, and I think the challenge that we have is that we don't, because this is real life and it's happening so fast and it's evolving so quickly, we don't have the tincture of time. And so, things have already started. We're trying to do everything we can to be very thoughtful, rational about it, but yet it's already in place. And so I agree with Dr. Persse that what we're really trying to do at the end of the day is to say, what information do we have? Where are the gaps in the information? How do we fill those gaps? And in the middle of flu season, we have these things called ILI Sentinel testing, right? These are healthcare providers that are doctors, nurses that are testing people, and based on that, they say, here's what we think is amount of influenza or flu in the community, and that's not what's happening here, because you have just random places where testing is occurring. So we've got to really figure out how to really strategize so that we can now make some meaningful use of the data that's coming in. So it's not random data, not random information, random numbers, but it really gives us a narrative, a story, because that's what all of us want, is what's the story of what's happening in this community? How do we actually show that and share that with our own entities, but also with the community? And I think that's key.
Okay. So are we going to get there? Are we going to take any steps to get there?
Well, we're taking steps. I know that our department is, and I'm sure you are as well, but we're currently trying to design a study to look at that. It'll be limited, unfortunately. I said a minute ago about what I would like. I don't think we're going to be able to get to where I would like, because we have limits. But we will be able to have some insight into what is going on. And I'm sure that the city and the county will work together on similar type projects, but these are not, they're expensive. And not only that, but if you do it truly random, then you wind up testing people who otherwise wouldn't have been, they didn't want to be tested, but they didn't think that they wanted to get tested. But it really needs to be a random assortment of residents.
Are antibody testing available now, and how does that factor into what we're talking about?
Okay, yeah, they are available. We're trying to figure out what to do with it. Just as I was coming here, the governor of New York, Governor Cuomo, had mentioned that they've got antibody testing, and he gave a percentage, and I can't remember what it was, like 10 to 15% or something about that for New Yorkers that they're testing positive with antibody. All that means is that they've somehow been exposed. Their immune system are showing the antibodies. They're testing that. Is it missing the people we've talked about before, 3 to 5 days after exposure, which there's still a lag here that the antibodies are produced. So I think it's useful for certain things, but there's a lot that we haven't worked out. Okay, so if an antibody test is positive, does that get reported to a health department as being a positive test, like a virus test that we've been doing? Is that the same thing? That has not been worked out, as far as I know, and we're still trying to figure these things out.
And not only that, but I still remain cynical about those tests, because my understanding, I looked at a package insert, so whenever anybody gets their medication, it comes in the bottle, comes in the box, right? You open it as that thing with all that tiny print. Well, I actually read one of those. And what it said was what I knew, but I wasn't sure whether it was going to be in there. But there are a number of viruses that can turn those tests positive. And so it's unfortunate that it's not specific for the virus we're asking the question about.
That's right.
And so yet another shortcoming.
That's
It
right.
tells you that you have a virus. Moving on, what can be done at your level to prevent the tragedies that are happening in the retirement and nursing homes? And in retrospect, do you feel that our city, county agencies did enough to regulate the local businesses and protect our most vulnerable senior citizens from total breakdown of health sanitation rules? Start with the fact, who regulates nursing homes?
Well, I was just going to say that, you know, the certification, regulation, all that is really at the state level. So I think that's one aspect of it, at least from the facility standpoint. We've been working hand in hand with obviously local regional partners, but also with the state on this. And state has provided a lot of information, a lot of guidance. Obviously, there's guidance from the U.S. Centers for Disease Control Prevention. That's really about nursing homes and long-term care facilities. And then we also have been trying to do our best to get information to our nursing homes and our long-term care facilities. I think the answer is that time will tell. I mean, we have had some clusters of COVID positive in nursing homes and long-term care facilities within our community. And we just have to continue to, as we move to this next phase, recognize that that's continues to be the at-risk population that we're concerned about.
Yeah. The crux to your question, from my standpoint, was what can we do to protect those individuals? And so, just like you, our health department has been working with a lot of the nursing homes that are within our jurisdiction to give them the information and to get them up to speed with the new recommendations that come up from the CDC. A lot of them wanted testing, and so we've been able to connect them with labs that will do testing for them. But I still warn people to remember the test is not a vaccine. So when they get the testing done, they find out who in the facility, residents and employees who are infected, then that helps you. But protecting means minimizing the exposure. So for an elder person, it's putting them in solitary confinement too. So it's really difficult. You've got to minimize that exposure.
That's right. And there's a responsibility on the healthcare worker as well within that administration of the facility, because ultimately Dr. Persse and I can't go to every facility and see if somebody's wearing their gloves, and because there's still way too many of them. It's really about how do we do this in a way that's helpful for everyone.
Okay, thank you for joining us for the COVID-19 update with our two top public health docs. We're going to take a break and be right back.
You have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
doesn't mean that we can't be alone together.
How do you protect yourself and others from coronavirus?
Avoid touching your eyes, your nose, and your mouth.
Wash your hands often with soap and water for 20+ seconds.
Clean and disinfect surfaces and objects.
Together, we can help slow the spread.
Respond to the upcoming 2020 Census Survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
With coronavirus spreading, people at higher risk must take extra precautions. You are at higher risk if you're over 65 or if you have an underlying medical condition like heart disease, chronic lung disease, diabetes, or if your immune system is compromised for any reason. If you're at higher risk, stay 6 feet or 2 arm lengths away from others. Better yet, stay home if you can. The choices you make are critical. Please visit coronavirus.gov for more information.
Wash, washy, wash, washy, wash, wash your hands. Scrub them while you sing the song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers in the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
Well, welcome back to our COVID-19 update sponsored by the Rotary Club of Houston. With our two top public health docs, A lot of questions about testing. Last week you mentioned that none of us believe enough testing is being done. Any change to that status?
No, I still wish we had more testing.
Tale of two cities. I think we've gotten better. We still aren't where we need to be.
Right.
So are we testing more today than we were last week?
Yeah, we are. So probably the big thing, well, it depends on last week, but the big thing for us is that, and for you as well, is that with our federally supported sites, it went from 250 to 500. So that's a lot. But there have also been some more sites in the private sector that have stood up too. So that's helpful. But we're still not, this is a big community, right? Mm-hmm. Between the two communities, we got, what, 5-6 million people. And that's a lot of folks.
That's right. And we still have capacity at our two federal sites. And we've even moved to, now, as you all had done, moved to prioritizing those who are symptomatic, and then obviously without symptoms, excess capacity. Yes, let's test you. And we haven't been able to really get a filling of those spots. We're doing everything we can. And so we're finding that our mobile testing that's in the community is now potentially taking away from the other sites because people are like, hey, this is closer to my house. Mm-hmm. So this is a, again, challenge. So I'm looking at the entire picture, which we don't have a good picture of, but I'm looking at the entire picture of how much testing is happening in the community. I know it's better, but it's certainly not where we need to be.
And so what you're really saying is that, access, accessibility, mobility is really influencing the amount of testing that's being done.
Right. And also, our sites are free. In the private sector, some of them, because they've got benefactors that are supporting them, but in others, they expect your insurance company or free to pay, and that's another confounder to it as well.
And everybody doesn't have insurance.
And not everybody, right.
Some personal service businesses are scheduled to begin opening soon. Although we all want to look good on our online conferences, how can we keep safe in such close proximity to hairdressers, which you and I don't have to worry about, Persse, as an example over what is prolonged time for some of us?
Yeah, the confounding variable here is the concept of asymptomatic or pre-symptomatic spread and even minimally symptomatic spread. So, I worry about, as we move forward, I worry about the people who are spreading virus and don't even know it. And as you pointed out earlier, Dr. Shah, it's not just wearing the mask. That works in concert with social distancing. And so when things like, when you're with your hairdresser, and of course I have no insight into this at all, only what I've seen in the movies, but when they're that close to you for a long period of time as they work on your hair, there's no social distancing going on there. So even if you're both wearing masks, it's not as safe as we would like it to be.
Yeah, my latest haircut was my wife. When I was half asleep, she just started snipping my hair because she said that it's not going to work. I'll tell you, I might be doing that for a while, and I do think that the social distancing is a really key issue. I mean, obviously, both parties wearing masks is important, and obviously hand hygiene, all those things we're saying, but how do you really have now a very intimate, setting now with that individual who's cutting your hair, or doing something else, nails or whatever. And so that's a piece that we just don't know how that's going to work out. So we want to make sure that people recognize there is risk there.
So how would you characterize the level of risk?
Well, I hate to say this, but I'll do my best to say it in a very blunt way, that a lot of these, we don't know the level of risk. There is risk. It's probably lower than certain activities. If you are without a mask, if you are obviously not washing your hands, I mean, there's all that, but there is risk there. And whether it's low to moderate, it depends on how much the individuals are using those practices, masks, etc. But actually the key that we don't know is how much is that individual, either the person whose hair is getting cut or the person who's cutting the hair, how likely is that person is actually with COVID-19?
Well, in terms of how much risk, everything is relative, and so I am not at this moment trying to say anything political, although it's going to sound like I am, but probably one of the highest risk things that's going on today are the people who are going to these rallies and standing in close groups and yelling and not wearing masks. And that's at a higher risk than here, because in the hair center, at least it's just two people.
That's right.
And hopefully they're both wearing masks. But when you get people, this is like things like sporting events. I worry about it. I wonder about sporting events in the future. But you get large numbers of people jumping up and down and yelling and screaming, and whether they're cheering or arguing, doesn't matter, and no masks on. That's probably one of the highest risk things anybody could do.
That's right.
And we see that going on in the community.
Right, and I wanted to, that's a great point, because we had Passover, we had Good Friday, we had Easter, and now for Muslims we have Ramadan that's starting. And again, it's not just the social distancing, it's also this people coming together piece. And we've got to do everything we can to remind everyone that, look, those are the risky activities that are going to potentially transmit this to a lot of people, and we got to be careful.
So what's your best advice about opening back up?
My best advice is we need to really think this through, and that's both from a societal, governmental standpoint, and also from the individual business owner. You really need to think through what you're planning on doing and how you're going to manage your business, manage your employees, and manage the customers as well, in order to make sure that this whole thing doesn't come off the rails and we wind up having to implement all these draconian procedures again. That hurts everyone. So let's take the time now to think ahead, make really intelligent decisions about how to manage your business moving forward.
Yeah, the hidden story of this is that our community has been by and large successful in this pandemic, and that is the story of the community. The challenge that we have in public health is when we actually do a good job and there is success, then a lot of times people say, well, then why did you do all that? Because it obviously wasn't an issue. And I think there's a really big concern in our minds that if you abruptly and or without a rational means of how you go about opening things up, that you can actually undo all this great work that all of us in the community have done.
Are we past the peak?
You know, I'm one of those people that lately I've really been talking about the fact that it's not necessarily anything more than peaks or not peaks, but this is really about, we've seen increase in our healthcare system from COVID-19. It has not surged to the point where our healthcare system was not able to actually handle it. We also recognize that we don't have enough good numbers on what's happening in the community. And so what this leads us to is the final piece of this, which is that means that when we start to open things back up, the concern is in 2 weeks from that decision to open up, are you going to see an additional transmission surge? And I just don't know.
Right. You know, like I said at the Judge Umair's thing yesterday, the peak, we need to get away from this idea of have we peaked, because that suggests that the peak is an event. And it's not an event, it's a phenomenon. It is when all of our efforts to slow down this virus are actually matching the power of the virus to spread. So if we can get to the point where we've neutralized that, that's your peak. And remember, that's just when it's a tie at that point. We're not winning.
That's right.
Right? And so that's not an event, that's a phenomenon. And as time goes on, we need to continue that, and at some point we need to start winning.
So the CDC director mentioned, and there was some controversy about this, that possibly in the fall that there might be a new wave. How do you react to that? And we have less than a minute.
I am worried that we are going to have a second wave. I just don't have much information about what that looks like, because I can't forecast the future. But I think when Dr. Fauci and Dr. Redfield, both the NIH and CDC say these things, I take pause, and I'm worried about it.
Yeah. I think when you look back across history and pandemics, it's common for there to be a second wave. We've seen it many, many times before. I don't know how much it's going to correlate with the flu season, because there's all kinds of variables with that. Certainly, if we have a flu and this going on, it's going to be confusing.
That is one of the things that he mentioned.
Yeah, it's going to confuse the picture.
Yeah. So, you know, I'm really grateful for y'all participating in this event. This is the COVID-19 update sponsored by the Rotary Club of Houston. I'm grateful to our club president, Kathy Finninger. My name is Stephen Williams, director of the Houston Health Department. We'll be back with you next week to give you an update on the COVID-19 pandemic